Okay, let's dive into this explainer. I am so glad you've joined us today because, well, we're talking about something deeply fundamental to our daily lives, yet it's rarely discussed until it actually becomes a problem. Welcome. I'm speaking to you today directly from the American Wellness Center right here in Dubai Healthcare City. Today, we're focusing on our swallowing assessment and dysphagia management services for adults. We absolutely know that experiencing swallowing difficulties can feel incredibly overwhelming, and our goal with this explainer is to walk you through our deeply compassionate, evidence-based approach to helping you, or maybe a loved one, regain comfort, safety, and confidence.
So, let me ask you, have you actually ever thought about how you swallow? Probably not, right? It's kind of wild, but it takes over 30 different nerves and muscles working in perfect harmony just to swallow a single sip of water. For the vast majority of us, it's a completely automatic reflex. You take a sip, you eat your favorite meal, and your body just knows exactly what to do. You don't have to map out the coordination of your breath, your tongue, and your throat muscles. But what happens when that automatic reflex suddenly requires a ton of effort? We absolutely want to validate the anxiety that arises when swallowing suddenly becomes difficult or feels unsafe. It can be a very frightening experience. If you're feeling that way right now, please know it's completely normal to feel anxious, and more importantly, you are not alone in this. Before we get into the clinical details, I want to share a little bit about who we are and why you can trust us with your care. The American Wellness Center laid its deep roots back in 2016 with our inauguration right here in Dubai Healthcare City. By 2024, we proudly expanded to offer over 20 distinct medical and mental health specialties. Today, today we have the immense privilege of supporting thousands of patients of all ages across the region. We built our reputation on being Dubai's leading multidisciplinary healthcare facility, fully committed to ethical, evidence-based care. What's truly impactful about our growth is the sheer scale of the expertise available to you, all under one roof. We have a highly collaborative team of over 60 Western-trained clinicians. When it comes to something as intricate as a swallowing disorder, you need absolute confidence that you're in the hands of highly qualified experts. That number, 60 plus, it represents our dynamic, multidisciplinary family. These are experts who communicate with one another daily to make sure you receive the most comprehensive care possible.
Section 1. The hidden struggle of swallowing. We call this a hidden struggle because, unlike a cast on a broken arm, swallowing difficulties are mostly invisible to the outside world. Yet it is an incredibly isolating struggle. Think about it. Mealtimes, which are usually a source of joy, connection, and family bonding, can just quickly become a source of dread. We approach this topic with a professional yet deeply empathetic understanding of how this hidden struggle affects your day-to-day life. The clinical term for this is dysphagia. Basically, dysphagia is any difficulty in swallowing food, liquids, or even your own saliva. It isn't just about discomfort either. It makes eating and drinking tiring and sometimes genuinely dangerous because of the risk of choking or food accidentally entering the airway. And beyond those physical risks, it can severely impact your nutrition, lead to dehydration, and drastically erode your social confidence when you're dining out or just eating with family. Section 2. Recognizing symptoms and causes. What we consistently see with the patients we support is that early recognition is the absolute key to preventing serious complications like weight loss or chest infections. Let's look at how this manifests in everyday life. I want you to ask yourself, or maybe think about a loved one, does food ever feel stuck? It's a very poignant, direct question. It's a highly personal, physical sensation. Sometimes it feels like a pill that just didn't go all the way down, or maybe a sensation of heaviness in the throat or chest after a bite of meat or bread. That physical experience is often the very first red flag that the intricate coordination of swallowing is slightly off balance. Building on that sensation, there's a set of common symptoms we evaluate. We're looking at things like coughing or choking during meals, unexplained weight loss. Actually, scratch that. It's not just weight loss, it's also that constant feeling of food sticking in the throat, recurrent chest infections or pneumonia, and mealtime fatigue. That's where just the act of chewing and swallowing leaves you feeling totally exhausted. I want to emphasize something strongly here. Even occasional choking or coughing when drinking water is worth bringing to our attention. You absolutely do not have to wait for it to become a severe daily occurrence to seek help. And this brilliantly illustrates why getting a proper assessment is so crucial. You see, dysphagia generally develops in one of two ways. Swallowing issues can appear literally overnight, or they can creep in slowly over time. Sudden causes almost always follow a major medical event. We're talking about a stroke, a traumatic brain injury, or maybe following head and neck surgery. On the flip side, gradual causes might be linked to progressive neurological conditions like Parkinson's disease or multiple sclerosis. general age-related muscle changes, or even chronic throat irritation from severe acid reflux. Understanding the exact origin of the problem, that guides everything we do next. Let's move to Section 3, our comprehensive assessment process. We know that anxiety often comes from the unknown, so we want to completely demystify the journey to recovery for you. Here is the gentle, clear, and highly supportive path our experienced speech and language therapists take to understand exactly what's happening. Step 1 is a detailed case history and symptom review. Simply put, we listen to your story. Step 2 is an oral motor examination, where we look at the strength and movement of your mouth and throat. Step 3 is the clinical swallowing assessment. This is where we observe you with various food and liquid textures, checking your posture and timing. And finally, Step 4, but only if medically required, involves a referral for instrumental testing like FEES or VFSS. These are specialized imaging techniques that literally let us see inside your throat while you swallow. It's a thorough process, for sure, but it is always adapted to your comfort. Section 4, personalized therapy and management. Once we have total clarity on the issue, we shift our focus to action. In our experience at American Wellness Center, the most effective path forward is built on non-medical, empowering interventions that you can actively participate in. We align our therapy goals with specific, tailored strategies, and it works beautifully. For instance, if the goal is muscle strengthening, our therapeutic strategy will include specialized swallowing exercises. If the goal is immediate safety to prevent choking, we'll work on breath-swallow coordination training. And if the goal is simply mealtime comfort, we might implement postural adjustments, literally just changing how you sit, or making specific texture and diet modifications. The whole shebang is designed to make eating and drinking safer and infinitely more enjoyable. I want to pause here for a second because this is a really common question we get. Our speech and language therapy interventions for dysphagia involve absolutely no medication. It's a strictly non-pharmacological approach. It's a gentle, highly respectful intervention fundamentally focused on maintaining your dignity, your independence, and your overall quality of life. Now, of course, if medication is relevant to your underlying condition, we can seamlessly manage that because of our unique clinical setup. And that integrated care is our unique advantage in Dubai Healthcare City, because we're a vast multidisciplinary center. If your swallowing issue is related to a neurological condition, we just coordinate directly with our in-house neurologists. We collaborate with ENTs, psychologists to help with the emotional toll, which is huge, psychiatrists, and nutrition specialists to ensure your dietary needs are perfectly met. We make sure every single aspect of your health is covered, all under one coordinated umbrella. It's like a giant puzzle, and we have all the pieces right here. Section 5, empowering you to thrive. This is where we focus on the highly optimistic, tangible outcomes of dedicated, personalized therapy. It's the light at the end of the tunnel for our patients. When you commit to this process with our therapists, the transformative results are just truly beautiful to witness. What you gain is safer, much more efficient swallowing. You achieve improved hydration and nutrition because you aren't afraid to eat anymore. You'll experience a massive reduction in coughing or choking episodes, and perhaps most importantly for your quality of life, you gain restored confidence in social eating. We help our adult patients celebrate the return of joy to mealtimes, allowing them to sit at a restaurant or a family dinner table without an ounce of fear. I want to leave you with this core philosophy that drives literally everything we do here. Every person deserves not just to survive, but to truly thrive. So, ask yourself, if you could change one thing about your next meal to make it safer, more joyful, and completely free of anxiety, what would that look like for you? You don't have to just accept discomfort as a new normal. You have the power to reclaim your confidence, and we are ready to help you take that first vital step. Thank you so much for joining me for this explainer today.